Smallest facelift incision? Male here. Lost volume and some sagging has given me nasolabial folds and a little looseness and banding at my throat. When I put a finger in front of each ear and push up about 3/4 of an inch to 1 inch, things look much better. I'd like to avoid retro and pretragal scars. Is it possible to get a solid lift with an incision that's hidden at the top of the ear and into the hair? I'd expect some pulled skin at the ear and hair transplant to fix a shortened hairline.
Thank you for your question. You submitted a question without a photo, but basically from the question I understand that you're male, you have lost volume in the face, and you feel like you've gotten some nasolabial folds and sagging and banding under the chin or in the neck area, and you want to know what's the shortest type of incision that you can have for a facelift, whether above the ear, etc., as well as you are concerned about a receding hairline and about hair transplant. Well, I can certainly share with you my approach to male facial aging in the modern era, and there's a certain contrast as a point of me stating that. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Facelifting surgery has been a very big part of my practice for these 20 years. And certainly this is a time where we actually have a lot of different tools to help people like yourself. Again, in the absence of a photo or a physical exam, I can speak to you in general concept, but I think it will be very, very helpful. So to begin with, we have to understand what is facial aging, and whether it's men or women, we're still dealing with the same basic issues. We're dealing with volume loss, as you described, where you lose volume in the cheek, the bone structure, the face actually recedes inward, and you're dealing with sagging. The tissues, the support structures get weak and the skin sags. So 20 years ago, and even more than 10 years ago, the most significantly effective procedure would have always been some kind of facelift or a face and neck lift. Now the challenge for men, which is a big contrast when we're doing face and neck lifting for women, is the visibility of the scar and the effect that it has on hair-bearing skin. So back in the mid-2000s, there was this real growth and interest in short scar facelifting. And it really turned out to be a very useful tool in helping men with sagging skin and with dealing with some sagging neck skin. But the challenge is, of course, is that most men will have some degree of male pattern hair loss. And because of that, it makes hiding incisions very difficult, and it also makes the visibility of the incisions very, very important. So generally speaking, we try to hide the incisions on the inside of the ear opening, but it does have to extend above the ear and behind the earlobe in order to be able to move a skin flap. Now, what's different about the modern era? Well, with a greater understanding of facial volume loss, I often recommend a hybrid approach to this problem. What I'll basically do is a short scar facelift and combine that with something called structural volumizing. Structural volumizing means the use of a longer lasting filler, such as a Juvederm Voluma, to place on the bone structure and restore volume in the cheeks as well as even the jawline and chin. The point is that we're addressing two issues simultaneously. We're lifting loose skin and we're restoring volume. Now there are variations of this technique. You can also try to replace volume with fat, but I feel that the predictability of injectable fillers and the repeatability and this continuous aging process, which makes things change, plus the structural nature, which you can't do with fat, really gives the fillers a significant advantage. What I try to explain to male patients is that in order to get a neck to be really aggressively tightened, the incisions have to be fairly long in order to really deal with all that extra skin. So a lot of times I recommend more of a compromise. Most of the neck skin can be addressed with a lift from the facelifting portion, but with limited amount with the short scar. And it's a matter of balance and keeping it natural. Nobody wants to look at, notice these scars, and you want to minimize that from happening. We use modern regenerative medicine technologies such as the use of platelet-rich plasma and extracellular matrix to improve that scar so that it blends very, very well. But it really is, there's a real art to doing this, and I would even propose that with men, volume loss actually has a more significant impact than the sagging. And I would say that just strategic placement of volume alone can make a significant impact. Again, the aesthetic standards of men and women are always going to be a little bit different, and understanding the limitations of the incisions has to be factored in so that you are satisfied with the outcome. So I think that most likely a short scar facelift with volume correction will give you somewhere around 80% of what you're looking for, and I think will be a good outcome. Again, this is in the absence of even seeing a photo. So I'd say meet with qualified, experienced cosmetic surgeons and learn about these options. Everybody does it their own way, so you're going to have to meet probably with a few before you feel like you are comfortable with the options that are being presented. A lot of my colleagues, they basically see the world through the eye of a plastic surgeon, where everybody is a candidate for facelift, and dealing with some of the consequences may be something they're willing to deal with later. But I feel like that if we have this type of balance, we are able to minimize the issues and the negatives associated with facelifting surgery and maximize the positives by dealing with the volume loss with a limited amount of skin lifting. But again, this is a very, very specific, individualized plan that has to be developed. So I hope that was helpful. I wish you the best of luck, and thank you for your question.